I wanted to talk about the opportunities for us, and pretty much I think this is the opportunity that we have taken, and the speakers already touched upon a lot of the knowns about the disparities and what can be done. To put this into perspective, I wanted to share with you. Everyone probably knows about this, but the second largest the magnitude of the problem of gastric cancer as it affects Korean Americans. And so bring this all back to our home in LA and New York. The second largest Korean population outside of Korea actually is in the United States. According to 중앙일보 from 2010 or 13 data, looks like 2.1 million Korean Americans live in the United States. It's a little bit higher than the census that we have from the 2010 US Census, which is probably of Korean Americans with that are being documented is 1.8 million. So it's a huge population of Korean Americans that are being affected by gastric cancer or at risk. So the largest Korean American population is in Los Angeles. And this is why here, one of the reasons when I was working in New York, when I got recruited to City of Hope, it was very appealing for a gastric cancer surgeon interested in the Korean American community to move here because, you know, as the center, somebody called it the center of gastric cancer is Southern California, and Korean Americans happen to be in large numbers here. And you can see between 2010 and 2015, it seems that we have increased the number in Los Angeles area alone. So this is a major issue that impacts our community in Los Angeles for the policymakers and politicians or healthcare providers that are in this room. And we are very aware, this is a select group of audience, so we know that this is a problem. So I think we already gone through this already, and we know that it's an issue because even though the incidence is high in South Korea, the survival is really good because there has already been programs in place like screening programs with endoscopy, compliance rates, despite the fact that not everyone complies. There was a very much increase in compliance rate with the screening programs. And now early detection is above 60% and survival is consistent with that as well. In the United States, you can see the incidence is really low. It's like 15th, and but the survival rate is still poor because most of our patients get to see Dr. Klempner, who's a medical oncologist, because they have advanced cancers where interventional gastroenterologists can't really cure these patients, and surgery makes somewhat of an impact, but it's not for permanent cure. Recurrence rates are very high. So if you look at how it disproportionately affects Korean Americans, this is just a breakdown. This is reiteration of what was seen already and presented. So, you know, Korean American incidence rate of gastric cancer in men are high, disproportionately high, and so among women. So what's interesting to me is that just by, you said, well, the risk factor is if you are Korean moving to LA, but one thing that's interesting is if you move from Korea to LA, your risk decreases, right? So if you just move out of Korea, then your chance of getting gastric cancer is lower. I don't know. I mean, there must be something to the epidemiology of this and the environmental factors, the foods that we eat, all of these things that we know are risk factors that we can intervene. These are modifiable risk factors. And so I think there's an enormous opportunity for us as the Asian American Stomach Task Force has been put together as a collaboration to make an impact and really improve our lives. So what is the problem? Well, the problem is gastric cancer in Korean Americans. I mean, dumb it down to 101, we have a problem. Everyone should acknowledge that this is a problem and we need to solve it. And I think all of us, I'm like preaching to the choir because we all are here because we care. We want to solve this problem. I think we have a lot of answers in which we can address this. Well, what's the solution? Well, we're the solution. We're in this room. We care. We have institutions in Southern California, representative from the East Coast. The Korean American Medical Association has been putting on conferences annually that address disparities that impact Korean Americans. And gastric cancer has been one of those topics for year on, year out. Dr. Shin is here representing KAMA. KOGMA put on two conferences in the last 2 years. Gastric cancer has always been a major topic. We talk about this, and I think we're making finally more progress. We have representatives from, I guess, 5 of the 7, the high volume gastric cancer centers in Korea, experts, world-renowned experts doing clinical trials in this area. And I think, as I didn't have this before today, but with Dr. Hwang here, there is a group, the collaboration actually has already started in some, and I think the Asian American Stomach Cancer Task Force may be a platform that can be used, or another individual platforms, but the collaborations are beginning to form and to get stronger. So I think it's important that we acknowledge the gastric cancer ethnic disparity is a major problem in our communities. And I'd like to borrow some of the slides that were presented in the room, especially the recommendations that Dr. Hwang had in his, because then I want to take that slide and I want to share wherever we go that this is a problem, and we are recommending some things or suggesting that Koreans be screened. Well, we need to commit to this collaborative, not just say we need to have one, but commit to it so that we can actively play a role in how to solve this problem. Create diverse Korea-US teams. Obviously, there's expertise here in this room, and those who couldn't join us today or tomorrow, actually. And then the major issue is finance. It's like money, right? Insurance companies don't want to pay yet, but we need to find evidence. And in order to find evidence and data and research, we need funding. We have dedicated academicians working on this. We do it because of passion. We try to find funding, but gastric cancer funding in the United States is like below, if you have a big chart, if breast cancer is up here and gastric cancer falls off the grid, you can't even see it. The dot is so small. And so anytime you try to do some research in gastric cancer, they're like, no, sorry, rejected. I have a lot of, those rejections on the board. If you put the same funding in for pancreas or colorectal, it's like here's your $5 million, go find the solution. And so I think it's really important that we figure out a way to finance and fund our research, and then formulate a comprehensive strategy to get this all done. These are some of I think we have answers to a lot of these. The extent of the problem, I think we know the problem. Getting data from Dr. Choi is like, it's very eye-opening to see what is actually happening in the community in Los Angeles, and perhaps, in Seattle and in New York. If we had this kind of massive data to say, hey, look, these patients are getting screened. Well, one of the reasons the H. pylori infection was so low probably is because they were already treated after the last time they had an endoscopy. And those patients who didn't have screening endoscopies, in the study that was done in New Jersey, the H. pylori rate was so high, it was like 47%. And out of 100 people, only four people had normal mucosa. They all had metaplasia. These were uninsured Koreans with no access to healthcare, who had to pay for their own way. And so we have some of this data. Well, we need to analyze this problem. And then, like all the speakers said, we can't screen everyone in the United States, and we probably can't screen every Korean American because it's not cost effective. Then how do we define the high risk patient population within that group? Is it 40 years, 50 years old? Is it going to be 70? Well, 70, they were already diagnosed with gastric cancer. So somewhere between 40 and 70, we need to figure out some statistics and determine the tools of prevention. right? A lot of this education that we need to do. Well, Korean Americans eat a lot of salt and disproportionately have smokers and drinkers. And so what about just prevention programs that we try to implement in our community, but haven't been very active in it? Determine the tools of screening. Well, is endoscopy going to be the end tool? How do we get patients to endoscopy? Is it going to be, there are so many new technologies out there, circulating tumor DNAs, a lot of studies going on in the United States and pancreas cancer, colon cancer, breast cancer. How many of these really brilliant scientists are working on gastric cancer? Well, few, I think, but not enough. We can bring them into our world of gastric cancer and say, hey, look, you guys have this tool in science. Why don't we use it for gastric cancer? There are a lot of efforts around the country going on right now. I think we have our first Stand Up to Cancer funded like grants. That is a proposal out there asking for experts in this field to actually contribute. So that's one win. And then figure out a focused program for our community. Obviously, we're going to have to implement it within our community to prove that it's going to be effective. And we're going to have to be like Korea, where we monitor our implementation over 30 to 50 years, because 50 years from now, our children and grandchildren, maybe they don't have to worry about gastric cancer anymore if they live in the United States, and they don't have to go to Korea to, get their $50 screening. So I would propose that we can imagine a world without gastric cancer if we were to continue to work together. And I hope, and I'm very, very excited that we're all here to be able to work on this problem together, and that this has been already in the 2 hours. I think we made far progress in my mind, and very excited. Thank you very much.